So we're just going to go over some of the landmarks as far as the pelvis and the thigh. So surface anatomy, obviously, you can see various different things, leg crest, gluteal muscles, then this can be the gluteal fold. And then palpation, we could probably do, I mean, ideally we would get to do these with tables. If some people want to get out tables, you can, but I think what we can do is try to do them probably standing. And then maybe next week we'll get out and do the tables and do a little bit more work with that. Okay, so basically, if you can start with the iliac crest, right? You can feel the different landmarks on the iliac crest. And then as you're coming back here, you're going to find the PSIS. And then you can come in and you can hook underneath the bottom of the PSIS here. Okay? So after we go through this a little bit, I can come around and we can come around and make sure you can find everything. Right? And then coming down here, you can find your greater trochanter, right? And if you're not sure, you can move the thigh like this, you can feel it moving. Or if you come across this way, it's going to stick out. Or also you can feel it when you rotate. Okay. Then as you come from the PSIS here and you go into the center here, then you're on the sacrum. Right? So you go between the PSIS, then you're along the sacrum here. And you may be able to pick out the spinous processes of the sacrum here.
Is that like the individual symbol?
Yeah. And we're not really going to get into doing too much pubic bone palpation, obviously, right? Okay, so if there is a situation like I've done situations where I've had to adjust pelvis to the pubic bones and stuff like that, what usually you can do is use the patient's hand to do the palpation. Like if you say, I'm going to use your hand to palpate. And obviously you're not going to get the same sensation of actually palpating, but you can still do some that way where it's a little more appropriate.
We also get people coming in with hernia scars. I've done quite a few guys with hernia scars that have had really bad abdominal pain. And it's right down in there and stuff like that.
So do needling?
Needling and Easton the crap out of it.
I mean, obviously in certain situations you're going to be needing to do, if you treat, obviously putting needles in that area, you're going to need to get down to the nitty gritty, but just use your discretion and make it appropriate. All right, so then you can find the ASIS. So that's the front here. You can sort of hook up underneath it. All right, so that's going to be here. Okay, and you're not really going to be able to palpate the AIIS. Okay, that's going to be deep underneath a lot of these muscles there. Okay, but basically, if you bring your leg up like this, obviously some of these muscles, if you follow the contour of the thigh, that's going to pretty much put you right there to the ASIS. And then just to make sure you're on it, you can hook underneath, hook on the edge underneath it. And then, this part of the iliac crest is going to be more of the bony part that you can palpate across here. Okay, and you can trace it all the way across the top to the PSIS here. And then, so just medial to that PSIS, that's basically going to be the sacroiliac joint. And then when we get the tables, we can practice it. You can actually palpate the motion in the sacroiliac joint. So then obviously it's pretty easy to find your ischial tuberosity, right? That's the big bone that you're sitting on. We usually call it your sit bones. So if you're not going to be able to feel it real well, but you can actually get to where you're doing for the AIIS. That's going to be more inferior. That's going to be where the origin of the rectus femoris. And then you can palpate along the sacrum. In some cases, you may be putting needles into these foramen here where the nerves come out. So that's going to be just to the lateral of the midline. And you're palpating on the sacrum here. You have this spinous process, which are going to be a little bit tough to feel, but if you're coming down from the lumbar, so I should put this up. So these will be the sacral foramen here. So those are where the nerves are going to come out. The nerves are going to come out posteriorly as well as anteriorly. And then if you're palpating down low enough, then you can get to the coccyx. So again, here, if you find the PCIS, as you go just medial to that, that's where the sacroiliac joint is going to be. And one of the things that you do to palpate motion in the sacroiliac joint is what's called the gapping test. When the patient's prone, you can feel on the sacroiliac joint here, and by moving the leg out like this, externally or internally rotating, you're going to induce some motion into the sacroiliac joint. And then there's also tests that you do where, well, we can practice this now. So you need to partner with somebody and then have one person stand like this, and then you're going to hook under the PSISs, and then as you raise one leg up like that, that PSIS on that side is going to go down.